Well, the treatments consist of medication, which is something that a lot of people don't like to hear. They say, well, we don't want to give our kids pills. And sometimes parents will not allow that treatment for quite some time. What most people seem to need to know is that these treatments are incredibly safe. There's been more studies done on the treatment of ADHD and the pills used than probably any other drugs that we have out there. So they are considered safe. The stuff in these pills is the same today as it was 30 years ago. It's basically Ritalin or a form of dexedrine. Ritalin came about maybe in the late 60s, 70s, and it's used today, but it's been put in different long-acting preparations to make it more compatible with a normal day. One preparation is a drug called Concerta, another is a Metadate, there's something called Ritalin LA, something called Focalin. So that's the methylphenidate group. And these are in the stimulant category, and they're controlled substances, which means you can't get a refill without a prescription. And then we have the amphetamine group, which is Adderall, which is a pill, and then you have the Adderall XR, which is long-acting, and something called Vyvanse, which is kind of almost like a souped-up Adderall XR. There is one non-stimulant treatment, which is called Strattera. That has the chemical structure of an antidepressant medication. It was discovered, again, a lot of accidental discoveries or in psychiatry. It did not make it as an antidepressant, so they never marketed it, but they tested it for attention deficit disorder. It proved to be effective. The thing about Strattera is you got to take it every day, and it sort of builds up in your system. You got to get the right dosage. But the typical treatment for attention deficit disorder is going to be a stimulant. And the trick is to go slowly and not put people on dosages that are too high. Now, there are side effects to look out for. I think part of the problem that's happening today is that of all the prescriptions that are being given out, there's more being given out by primary doctors than psychiatrists. And I think when seeing a primary doctor, there's less of a screening effect and obviously less knowledge, and I think there's a greater intimidation factor by parents. Parents might walk in and say, you know, my child's not doing well in school, I think he needs to get on something. And the primary doctor might say, here, answer a couple of these questions, here, why don't you try this medicine? But there isn't a systematic follow-up, generally speaking. By the time you get to see a psychiatrist, that has happened. A psychiatrist, that's what they do, that's their specialty, and they will be monitoring it for side effects. There can be dangerous side effects. You can get psychosis, suicidal thoughts, and there is a tendency towards addiction on some of these drugs. That's why they're carefully monitored, and the physician has to be sensible in who he dispenses his medication today. It is said that the drugs go on the norepinephrine system, I believe, and the different neurotransmitter systems. They go into your body and they travel into your nervous system, and I don't think everybody knows 100% how they work, but there's more and more knowledge coming out on that every day. And they just sort of regulate an aspect of the neurotransmitter system that helps them to focus a little bit. And actually, surprisingly, some kids are even calmer on it. The drug, the most common, of course, is going to be a drastic decrease in appetite. And a little known fact that Adderall was originally discovered as a diet pill in England and then became used for attention deficit. And all of these drugs will decrease appetite, and it's not uncommon for children not to eat well in the middle of the day, but may become ravenous in the evening. Also, sometimes coming off the pills in the afternoon, some kids might become irritable and crabby, and you have to look out for that. Like anything else, initially if they get stomach aches, that might be a limiting factor. But most of the time they're generally well tolerated. The key is not to be overly aggressive with dosages and to kind of monitor things carefully with good feedback. How long you need to be on these drugs is an important question. Usually what I tell parents is, well, how long do you think your child's going to be in school? So because one thing about school, every year gets harder than the year before. It does not get easier. So therefore, they're going to be on it almost all the time they're in school, and probably indefinitely.